Hi, my name is Ariona.
Hi, my name is Ryan. We are clinical scientists in MRI and ultrasound physics at Guy's and St Thomas NHS Foundation Trust.
In my role as a clinical scientist, I take care of MRI and ultrasound scanners. I perform tests of these scanners to make sure they're working correctly and are safe for the patient. I also make sure that the images are as good as they can be, so that doctors who look at the scans can make an accurate diagnosis. This way, patients can receive the right care.
We have a crucial role in the patient pathway, especially when a patient may need a different approach. For example, they have a metallic implant, such as a pacemaker. Since MRI scanners are essentially huge magnets, they can interact with the implants that patients may have inside their body. We may have to tweak how the scanner takes the images and may carry out an investigation to ensure that the patient is completely safe and comfortable inside the scanner.
We work with many different professional groups, such as radiographers who scan the patients, radiologists, doctors, and other clinical scientists. We often meet to improve and create new clinical scans so that we can better care for our patients. We form a large team where the physicist serves as a behind-the-scenes role. If you don't see us, then everything is working as it should be.
A job in MRI and ultrasound physics can lead to a lot of other places. As clinical scientists, I see us as the bridge between the routine clinical work and the cutting edge of research, looking at how we can improve our practices.
MRI and ultrasound are valuable tools in clinical research, and the pace of new development is really exciting.
One thing that's surprising about this job is that there are so many more research opportunities than you would expect. An MRI scanner is such a wonderful piece of technology, and everyone wants to use it for their research.
Many roles within the NHS have the opportunity to conduct research alongside clinical activity. I have just started training to become a consultant clinical scientist on the Higher Specialist Scientist Training Programme. This is a 5-year programme that is dedicated to understanding the complex roles of leaders in the NHS. And part of this work is a research project. And at the end, I will get a doctorate.
I loved physics and biology at A-level and wanted to find a way to combine the two. I did biomedical engineering at university and eventually found my way onto the Scientist Training Programme, or STP. This isn't the only way to get onto the field though. A background in science, especially physics, is definitely recommended to become an MRI and ultrasound physicist.
I got to where I am now by doing A-levels in maths, physics and chemistry. I then went to university to study physics. During my time at university, I became interested in how physics was being used in healthcare. So I decided to explore medical physics and specialise in MRI and ultrasound. I want to make a difference in people's lives, and I love that I can do that through my job. I enjoy that the job is so varied day to day and that it requires problem solving and designing experiments to test new technologies.
My job is very dynamic. No 2 days are the same, unless you want them to be, and there can be a lot to get involved in. There is also a lot of room for creativity and ideas, and you are not limited to doing only the physics-based work. I also love the fact that we can travel around the world for conferences, where we can present our own work or listen to the great work that other people are doing.